Hi, for those that just joined us, we're just waiting a couple more moments for a few more people we're expecting, and then we'll get started. Well, hello everyone and welcome. I'm Elizabeth Heald, Chair of Kawasaki Disease Canada's Board of Directors. I am very excited today to kick off the first of 4 sessions in our new webinar series, The Heart of the Matter. We at Kawasaki Disease Canada are incredibly grateful for the many families all across Canada and beyond that help to share our messages. We are also very grateful for the many healthcare professionals who support us and are on our mission towards enhanced awareness, education, support, and of course, research to help find a cause. Before we get started, I'd like to share a few housekeeping items. You will see at the bottom of the page, if you hover your mouse, that there is a Q&A tab. Please use this to type any questions that you may have for our panelists, and we will attempt to get to all your questions today. We are recording this session and it will be available later on our YouTube channel. So we will follow with a link to that in the next few days. Now let's get started. I'm really pleased to introduce today's host, Karen Lynn. Karen co-founded Kawasaki Disease Canada with me 6 years ago. She is chair of our support committee and a key member of our board of directors. You will learn more about Karen and her son Isaiah a little later on. Shortly, Karen will be introducing our parent guests who will share their stories. But before I turn it over to Karen, I'd like to remind you that the experiences shared today are very personal and varied, the purpose of which is intended to invoke understanding and compassion for what families may endure when faced with a diagnosis. We also hope that today's session will help Kawasaki disease families to know that you're not alone. There is always someone that you can reach out to. Karen, I invite you to turn on your camera and please tell us more and get us started.
Thanks so much, Elizabeth. I'm so happy to be here today. As Elizabeth mentioned, my name is Karen Lynn, and my son Isaiah was diagnosed with Kawasaki disease in 2011, just before his 3rd birthday, and he was diagnosed at Sick Kids in Toronto. Before we get started, I want to talk a little bit about this idea of Kawasaki disease as a disease of unknowns, which is how I've always felt it could be represented. Most parents, myself included, had never heard of Kawasaki disease until their child is diagnosed with it. The diagnosis catches most parents off guard. It's something unexpected and unheard of. This makes it really difficult to navigate, makes it difficult to advocate for your child, and often makes it a lot more frightening. Over the past few months, Katie has been in the spotlight due to news coverage of children having what they refer to as Kawasaki disease-like symptoms and being diagnosed with MIS-C, or multi-system inflammatory syndrome in children, in correlation with COVID-19. While the connection, if any, to Katie is currently unclear, at least Kawasaki disease may not be completely unknown to some parents moving forward. However, when I talk about the unknown, it's not just about the unknown being Katie being unfamiliar to parents. There's still so much that doctors and researchers have yet to uncover. There's still no known cause for Katie and no available definitive diagnostic test. And while there are widely accepted treatment standards, there's still research into determining the most at-risk children and how to best treat them accordingly. In addition, researchers are still studying possible long-term effects of KD that may happen years down the line. It is this fear of the unknown that causes a great deal of worry for so many KD parents. Even if their child is successfully treated and recovered with no long-lasting heart damage, I know many parents still worry about other health issues that their child develops later on and wonder, could it be because they had Kawasaki disease before? Every fever puts a KD parent on high alert. With so many unknowns, it's often difficult to put those worries to rest. We are grateful to have 2 parents with us today, Shanna and Antara, who are going to share their own stories about their journey to a KD diagnosis and how they were able to navigate this unknown. So first, I would like to introduce our first panelist, Shanna Howitt from Guelph, Ontario. And Shanna's son, Owen, was diagnosed with Kawasaki disease in 2018 at the age of 4. Welcome, Shanna. If you'd like to turn your camera on now.
Hi.
Hi. Hi.
Thanks.
So glad that you could join us today.
Yeah, thanks for having me.
I was wondering if you could just start from the beginning. So you can start with when Owen first became ill.
Yeah. So, I mean, these stories, like you said, they're so varied and we could go into a lot of detail. So I'm just going to try to keep it as brief as I can. But yeah, so Owen he had just turned 4, maybe 3 weeks into being a 4-year-old, and was at daycare, and we picked him up and had a message from the daycare staff that they felt like he was starting to get a fever and get a little bit warm. And things like that weren't uncommon for us. Owen always had, ear infections, and he's the type of child who fevers very high, and we're used to those very high, scary fevers with him. And so we kept him home. And this one, though, I felt like right from the beginning was a little bit different. Normally, when he would get sick in the past, he would, perk up when he's on Tylenol or Advil or something like that, just for a few hours. But with this one, he really didn't. And there was some very odd things in the beginning that we noticed that we were just like, what is wrong with him? And we couldn't figure out what it could be. Those things were that his neck was very tender, and he was having problems like turning his head, and he was complaining about that. So as a parent, you think, could it be meningitis? You hear about that,
Absolutely.
you learn about that, right, when you're a parent. And so my mind immediately went to meningitis, because this high fever and the neck, and I'm like, that's really weird. So we ended up the second day, he was like really having trouble. So I took him into the doctors, and they had to move his neck around, and was like, no, he can move his neck. He does have a swollen lymph node, but we don't believe at this point that it would be meningitis. It's probably just viral, and they sent us home. And then the following day, he started having these like intense stomach pains that they would just come and then go very quickly, but he would be like screaming, holding his stomach, to the point that I had like my keys ready to take him to emerge, and then it stopped. And I'm like, okay, I guess we're okay, and I'll just hang tight. But then later that night, he started doing the same thing and vomiting, and still had this super high fever the whole time. So we took him into emergency. Actually, my husband did, and I stayed home with our daughter, who was asleep. So middle of the night, and they took him in. We talked about like the concerns of the neck, and now this vomiting and the fever. And they did like a urinalysis and blood work for him, and basically just said there's some inflammation, but that's very common with a child who's sick, so we would like to send you home. I did ask at that point to speak to the doctor on the phone myself, and said, like, I'm sorry, but I don't accept you sending my child home. You don't know what's wrong. This is concerning. I'm not convinced that you're convinced it's not meningitis. I was very stuck on this meningitis. That's all I knew. So I insisted that he was admitted, and so they agreed. And the next morning I went there, and we went through a few days in the hospital of them suggesting like perhaps it's an ear infection or something in his throat. And they did notice his lymph nodes, and I did mention to them that his eyes were really red, but he didn't have any discharge coming out. And one of the doctors did say at that point, like, pink eye is sort of the last of our concerns right now, so we think it's this. And so they said they thought it was a whole slew of things, and we started on antibiotics. And eventually the antibiotics, he started to get the well-known rash on his body. And so they thought that was maybe a reaction to the antibiotics. So they put him on an IV and changed the antibiotics. And then that rash happened on like day 4. And it was, to me, visually seeing that was probably one of the most shocking things. It started in his groin and worked its way up and like down his arms, but in his face and stuff. And he just looked so sick. But the rash would come and go. So it was very difficult to understand like what was causing it. And I know they're trying to figure it out, and they don't know either. But I think for us looking back, he did have incomplete Kawasaki. So he had like the eyes, and then he had like the rash that would come and go, and he had strawberry tongue, and his lips started to peel. But I kept putting chapstick on it because I'm like, oh, he's probably dehydrated. And all these things that we kept mentioning to the doctors as the days went on in the hospital. And I think the problem is that there's different doctors that are on call, different nurses that are there every day, and we are the only consistent common denominator in trying to fight for him. And I feel lucky that he was 4 and he was able to verbalize some stuff with us.
Right.
I know since this has happened with him, I've been on the Kawasaki Canada Facebook support group page, and I've read a lot of stories of parents who have children who are much younger or infants, and they can't even speak. And to me, like, that would be so difficult. At least he could say, like, Mom, my tongue feels funny, or something about his rash or whatever. So I feel lucky that he was at least at that age that he could talk about it.
Right.
So for us, sort of to move forward a little bit, we once he started saying his tongue felt funny, which was strawberry tongue, they thought maybe at the hospital that he was having a reaction to those antibiotics, and they put him on steroids to help with the reaction he was having. What we didn't know at that time is that steroids can also be used as a treatment for Kawasaki.
Exactly.
With the IVIG. So sure enough, after like 2 or 3 doses of steroids, his fever went away, and he still had the rash, and he still had the eyes, and very lethargic. I mean, I don't even know if he really ate anything while he was in there. But the fever went away. And so they sent us home, and they said, it's a viral thing. He seems like he's getting better. You guys are now discharged. You can go home.
Sorry, let me just ask that. So that's interesting, because you mentioned that he still had the rash, still very lethargic, but at that point the doctor still felt it was an allergic reaction, and that sending him home was the right thing to do, even with the constellation of symptoms that you had shown them.
Yeah. So he still had it. Basically, their determining factor was his fever's gone, so that means he's okay now, and he'll just sort out the rest at home. At home. So they even had done like an ultrasound on his lymph node, and it was like, yes, it's very enlarged. And so, all these things, as anybody now who knows Kawasaki, you're on the sidelines screaming like it's Kawasaki disease. But at that point, I mean, the dots didn't connect for them. And in speaking with some of the nurses and doctors after, like they said, we don't see this a lot here. But we ended up being discharged and going home, and we were given the steroids to give him at home. And for some reason, I thought I didn't want to do that. I was like, his body's been through so much. I don't really want to give him steroids. So I just carried on with the antibiotics and didn't give him the steroids. And then, I think we were on day 7 at that point. So day 8, he started to get a fever again. And I was like, this is insane. He's still got the rash. His cheeks are red. He can barely have any energy to like stand up, and his fever's back now. So I took him right back into Emerge, and they took about 5 hours to see us. And I remember saying to a nurse that if I'm not trying to be rude, I'm aware you guys are very busy, we were just here, but I will leave in about 30 minutes and take him to McMaster if someone can't come down and see me, because I'm very worried. He was so tired. He slept the whole time in this little cot at Emerge the second time we were there. And then a doctor who had actually been on call 4 nights ago at the hospital and ended up putting him on the IVs and saw the rash for the first time late one evening. She came down and she asked me to wake him up. And so I woke him up, and he opened his eyes, and his eyes were so bloodshot at this point. And she goes, does he have any discharge? And I was like, no discharge. He's just had these red eyes. And she's like, okay, I'll be right back. She left, and I was like, that was kind of abrupt. And then about 30 minutes later, she came down and said, I just had a consult with a cardiologist at McMaster, and we believe that your son has Kawasaki disease. She explained what IVIG was and said, we're getting it prepared. We're going to admit him, and we want to get this started right away. It should be ready in about 2 hours. So it's like midnight. I tried to call my husband. He's sleeping. Couldn't get a hold of anybody but my dad. And I was like, hey, they're telling me it's this thing, and he has to go on this IVIG. I knew nothing about this. They did mention like aspirin, and again, as a parent, you hear don't give your child aspirin and all these things, right? And you're so confused. So anyway, my dad just said, Shanna, this is probably the best thing you can do for him, and just give it a shot. They think it's going to fix it. You just have to try. So I said, okay, signed the papers. We went upstairs and they started him. And again, he was sleeping through the whole thing. So I guess it would be the morning of day 9 is when he received this treatment. He woke up after probably 8 or 9 hours of being on the IVIG transfusion, and he opened his eyes, and I was shocked because the redness was gone. His fever had greatly been reduced, almost to the point that it wasn't a fever anymore. His rash was starting to go away, and he had that sparkle in his eyes again. And the nurse came in actually when he was waking up, and I was like, are you seeing this? I can't even believe it. It was like this cloud that had been covering him for days was lifting.
What a difference, right?
It was, honestly, it was incredible. And it had only been a few hours. So he ended up finishing the course of that. And then it was very quick after that. He was discharged several hours later. He was extremely improved. And they had said at that point, he'll have to get an echocardiogram. They explained that there could be some damage and he has to go on aspirin. So we did have an echo 2 days later. I was hoping that there wouldn't be any issues because we caught it before day 10, and that was what I had been learning about.
Right.
And I didn't actually have a lot of communication with the doctor after that diagnosis. So a lot of the information that I was able to get after to sort of calm my nerves about everything was actually through Katie Canada. My sister connected myself to Elizabeth and then to you, and you guys helped me a lot with just trying to calm my nerves, and that, yes, this is normal. This is what an echo is. Aspirin is okay in this situation. And it did turn out Owen did have some dilation in his left ventricle artery after that first echo. He stayed on aspirin for 3 months. And then when we had an echo again, it had actually cleared itself up. So we are so happy that that was our outcome for Owen. And we did have another echo about a year later, and he's still luckily in the clear.
That's
so yeah, so that's our story. And we feel very fortunate that the doctor that caught it, she had actually trained at McMaster, so she knew a little bit about it. But it's still something that, friends of mine, family, nobody knew. So when we were telling people, they didn't understand it. They didn't understand how serious that this was. So it's very important to, I think, continue to talk about it and share.
Absolutely. And what I found interesting with your story, when we talk about catching parents off guard, when you look at the constellation systems that Owen had, you know it now, that if you ever hear another parent telling your story, you'd be like, oh, I know what that is. But at the time, you weren't armed with that knowledge, because if you were, then you could have advocated and said, well, I heard this thing, Kawasaki disease, and maybe it would have jogged something in one of those doctors, because all these doctors have learned this at one point in their career.
Mm-hmm.
But it's not always top of mind. As you said, at the hospital you were at, they said they don't see a lot of it. Or there's also, predisposed ideas that, oh, it's only in children of Asian descent, things like that. So they may not be looking for it necessarily in your child. So I thought that was one of those things that I talked about earlier about this being unknown. One of the things I wanted to ask is knowing what you know now, is there anything, well, obviously you would have done that differently, or maybe more of the question is there a message you have for parents based on your experience?
Yeah, so I would say the biggest thing that my husband and I did was we communicated with ourselves, between ourselves a lot, kept asking questions. We questioned the doctors quite a bit. We pushed really hard. And so I think ultimately, that first night, pushing and asking to be admitted, and then just following your gut, with those steroids. Had I given Owen the steroids at home for a few days till it ran out, maybe that would have, kept things under wraps or at bay for a few days. But very likely 3 doses of steroids would not have helped what was actually happening in his body. So I think just for whatever reason, I didn't want to give that to him. I didn't, thank goodness, because even having the steroids, being in hospital, then getting the IVIG on day 9, he still did have damage. So what if I didn't do that and ended up giving him the steroids, which would sort of placate, I guess is the word, for a few days. And then maybe it could have been worse. So I think the biggest thing is just asking questions, fighting, following your gut. And then wherever you can, just listen to other people's stories, because there may be something that could spark or trigger something in you that would maybe help you put 2 and 2 together.
Right, absolutely. And I think the other thing, I know you didn't mention it today, but I know you and I have spoken before, and you mentioned it, that you were taking photos of Owen's rash, because as you were saying, it was coming and going. Again, another thing that parents, I guess, is a general thing, because you wouldn't know, oh, I should take a picture because it might go away. But
Yeah.
those are the kind of things that can help get you to a diagnosis, because you were talking about incomplete, Katie. So when we're talking about these symptoms, they are looking for 4 or more for complete Kawasaki disease. But if they don't have record of all of them and they're only seeing one, they may not be seeing the complete picture. So I think that was a good point of taking photos, because then you could show, well, he had this rash 2 days ago, he doesn't have it now, but he also has a lymph node now, and he had the red eyes, so they can piece it together. So I think that was also something I thought was great from your story, because I, as a parent, hadn't done that with my son. I wish I had. So I think that's another great lesson that can be learned from your story. But that's great. Thank you so much for sharing Owen's story. I know it can be difficult, because I'm sure it was a really hard time for you and your family. So I'm so glad that you agreed to come on and share that with us today. So we're going to move to our next panelist. Our next panelist is Antara Ramkissoon from the Greater Toronto area. And Antara's son, Ian, was diagnosed with Kawasaki disease in 2016 at the age of 3. So welcome, Antara. If you want to turn your camera on.
Hi there.
Hi.
Thank you so much for having me today.
Thanks for coming on. So I guess the same as with Shanna, if we want to just start from the beginning and tell us a little bit about when Ian first became ill, and then we can hear the whole journey that you had to endure.
Sure. Actually, this is the first time I had the chance to hear Shanna's story, and it's just insane, right? As you listen to that story, just how many similarities there are, even though it may not have happened exactly the same way.
Right.
So, I can absolutely share. I think one of the things that I was thinking about when I knew that I was going to come here was his story is one in which I don't like to remember it, but I really want to remember it, right? Like I want to remember it because it's important, obviously, to acknowledge what has happened and try to share it as broadly as I can, even though I remember those days being like insane, right?
Yeah.
So Ian was 3.5 when he was diagnosed, and very similar to Shanna, he was in daycare. And if anyone knows Ian, he is a busybody, constantly, horsing around, goofing around. He's never sitting still and, not listening always. And he's just a busybody. He always has been. And so, being in daycare, getting a fever here or there, or having whatever bug was going around it was a normal thing, to be quite frank.
Right.
It was normal that, he was getting sick with whatever bug of the week at daycare, but he always, with some rest, he always bounced back. And so that was something that I always knew that I could count on when it came to Ian. Yeah, he's feeling really not so great now, but he'll bounce back within, 48 hours, maybe 3 or 4 days. Just he shakes it off. So it was different for me this time. It was the end of May of 2016. He had this fever that persisted beyond 48 hours, and we'd given him the normal Tylenol, Advil, and it didn't really it didn't take the edge off the fever. Like it was pretty consistent. It was consistently high, and he was complaining of when he was playing and when he was trying to horse around that he couldn't horse around. He couldn't look up. He couldn't look side to side because he was telling me about the pains around his neck. And I could actually visibly see that he wasn't horsing around. So I was like, that's kind of odd. So my husband and I were like, oh, maybe he just took a tumble, right? He's got a sore neck.
Right.
That should teach him better to not, and we as parents, we think, okay, he'll get better. But
Right.
He didn't get better. His stiff neck, I kind of put my hands around his neck and I felt like there was something swollen there. And so I was really concerned about this. And my mind didn't go, Shanna was saying her mind went to meningitis because that's what she knew.
Yeah.
I didn't even know, right? So my mind did not go there. And I didn't even think, anything terrible could have been wrong at that stage. He could have just fallen somewhere. But
Right.
when I noticed that the Tylenol didn't respond, my husband and I decided, let's take him to the family doctor. So we did. We took him to the family doctor. His doctor took a look at him, and he said, it appears to be a really bad case of strep, a bad case of strep throat. So he gave us some antibiotics, and off we went. He said, take a look at how he does, and if he's not well within the course of an antibiotic, then certainly bring him back. But he didn't see any obvious concerns. So we get home, we give him the first round of antibiotics and kind of keep an eye on him. And I want to say it was between 8 or 12 hours of that first dose, I kind of noticed the palms of his hands and the soles of his feet to be a brighter kind of a red, maybe a little bit more swollen. And he hasn't, and he wasn't horsing around, like he wasn't playing. And he was just kind of lethargic, sitting on the couch. Ian is not one to sit on the couch. That's not him.
Right. So that's a red flag for you right there, right?
Huge red flags, right?
Right.
He's not moving as much as he used to or whatever. And because even with previous, things that he'd had, he would still be playing. As long as he had Tylenol or Advil, he'd still be sitting there playing. He might not eat or whatever, but Ian was not moving. He had this weird swollen thing, and I kind of had my husband look at it. My husband was like, "You're overanalyzing," because that's what you do. So then I said to him, okay, let's keep an eye. But then I noticed that he also had this weird rash. There was a rash that broke out very similar to Shanna. It was like on the body, on his belly, his upper thighs, a little bit on his back. And I just really became very concerned. Like I became very uneasy because he had never in his life at that point had a rash to anything.
Yeah.
So I said, okay, this is weird. And I thought, you know what, maybe it's an allergic reaction, because I also don't put Ian on antibiotics, to be frank, because he was always better with Tylenol and Advil. So this is probably the first time, maybe second time he was on antibiotics. And so I said, no, I think it might be an allergic reaction. And we quickly rushed back to his doctor, because we'd noticed now it's been a couple of days, three days, I want to say, and he actually had stopped eating entirely, and he'd stopped drinking. So eating, okay, children stop eating. I was okay with that. And I was like, but drinking, Ian is always up for Gatorade. He is always up for ice cream. We were bribing him with McDonald's. He will always say yes to certain, you have your go-tos.
Yes.
Yeah. The go-tos were not working. He wasn't even drinking to this point, Karen. And
so this is red flag number 2, basically.
Red flag number 2. He stopped eating, he stopped drinking, and he's not moving. So at this point, I'm trying to get information out of him. Let me see what's wrong. Why aren't you drinking? Right? Like he would even have like freezies or go-tos, popsicles or go-tos. None of that was my go-to at this stage. So I was really concerned. And he started to complain that his tongue wasn't feeling, it was feeling raw, I guess. It wasn't feeling right for him. His tongue, there's something wrong with his tongue. So we take him back to this doctor, his family doctor, whom we know and we've trusted and have been a patient of his for a while. We go back to his family doctor, and the family doctor, taking a look at him now, said, you know what? I'm going to refer you to the ER. He is getting to the point of dehydration, and I'm worried. So we're going to send you to the ER. So my husband and I, off we go. We go from the doctor's office to the ER. I, in fact, think the doctor called the ER in advance, letting him know he's sending one of his patients, right?
Right.
So we get, and we're at the doctor, the ER was the William Osler Hospital in Brampton. And so we get there, we spend the night in the ER. The ER doctor, it was a busy night. The ER doctor took a look at him and simply administered Benadryl and asked us to try an oatmeal bath for this rash to see if that clears it up, and to continue to try give him some liquids. So when we got to the hospital, he didn't get the IVs, or he didn't get what he needed for his dehydration symptoms. What he got was Benadryl and an oatmeal bath recommendation to give him these liquids, or try to keep giving him liquids. And he said, let me give you a new antibiotic prescription. Right. So we're still thinking at this point, it could still be strep throat, and it could be maybe there was a reaction. And so now here's your new antibiotic prescription. So
can I just interrupt for a second? I just want to know, at this point, did Ian still have a fever?
Ian still had a fever. Yeah. Ian still had a fever.
I'm assuming when you went to the ER, you went through the list of all the things, right? Like fever, his neck is hurting him,
They can
rash,
see
he's
their
not
swollen lymph
eating.
nodes. Yeah.
So they examined him and saw these things firsthand at the ER?
They saw it firsthand at the ER.
Okay.
In fact, while we were there spending the night at the ER, in addition to the Benadryl, I think they also did the alternating Tylenol Advil every 4 hours. And if you're a parent, I think this is a familiar thing, right? Where they do that. So they did that. And he wasn't responding to that to bring down his fevers, but we were still discharged with a new prescription for an antibiotic.
Okay.
So that brings us to late afternoon on day 4. Okay, his fevers remained very high. He was extremely lethargic when we tried to give him that bath. In fact, he wasn't even going up the stairs. We physically couldn't carry him up the stairs. We decided we're going to draw a bath in the kitchen. So we got our tubs and everything ready to go. And he was not having it. And right then, and we thought, with the bath, maybe that'll help with his temperatures because we were grasping at straws at this point.
Right.
So right then, the weirdest thing happened. Ian's nose started gushing blood. It was a bloody nose, which has never happened before to my son. And there was a point where between my husband and I, he was thinking, well, he's obviously, hasn't been well. He hasn't eaten or anything, and a bloody nose with the high fevers. He thought, could be. And I was thinking, there's no way that this is normal because he's never had one before. And I think he's so ill to the point where this is his body trying to tell us something. And I said, he's not walking. I said, I'm not even going to drive to the hospital. I'm actually going to call the ambulance because my son is almost, I would say, unconscious at this point.
Yeah.
So we call the ambulance and we get back to the ER. We're in the ER. The doctors are running, several tests. They've got the history from our previous visit. They've got the files over from our doctor's office. I've got my prescriptions of the original antibiotic, the new antibiotic. We gave him Benadryl. I got all my medication with him because at this point, all this stuff is going through his body and there's no food or water going through. And he had stopped. There was no bowel movements for a couple of days now. And there was also no urine passing through for, I wouldn't say, over 48 hours.
Wow.
So they ran several tests and his health was quickly deteriorating. His blood showed high levels of inflammation, but there were no signs. There was no signs of bacteria, anything viral at that time. And this time we were actually blessed to have a different ER doctor along with an ER pediatrician. And this was now on day 5.
Okay.
And so having that ER pediatrician for some reason, because they do their rounds, I think, and he was just coming in from, I think, Toronto Sick Kids, and he was kind of passing through on day 5, and he was doing his rounds with his team. And with his team, they identified now 5 days of high fever. They identified the swollen lymph nodes. I forgot to mention, Ian also had the red bloodshot eyes that started on day 3. So he had the red bloodshot eyes, no discharge as well. I don't know that it were as bright and staring at you in the face because it could almost look like a child that hasn't slept for 4 days, bloodshot eyes.
Yeah.
So he had that. He had the cracked lips along with a strawberry tongue. He had that mysterious rash. And the swollen hands and feet that I told you about, they had started now to fade. So what I had seen at home after the 12 hours of the original antibiotic admission, that swollen hands and feet, it was like only I had seen it and I'd showed it to my husband, right? But that had now faded.
Yeah.
So with those symptoms, that entire team officially diagnosed him with Kawasaki disease.
Okay. And I'm assuming they in conjunction with the blood work.
In conjunction.
Okay,
yeah.
Good.
And what they said, Karen, was they said, this is a textbook classic symptom, or the 5 textbook classic symptoms of the disease. And with that, 2 things happened. They rushed him to an echocardiogram of his heart to take a look at his coronary arteries. And I dropped to my knees and started crying because I had heard of Kawasaki disease only once before in my life. And it was through Elizabeth, actually, who's here today, because Elizabeth and I had crossed paths a number of years ago when we worked together in the same organization. And I had heard about Dylan's story and I'd heard about Kawasaki disease. And that was the only time that I had heard about it. So I knew that this was not good.
Right. Oh.
So with that, we were asked to sign the paperwork because they were going to start his IVIG treatment. I was so nervous because I think I was in denial, but I was like, okay, we know what it is, but I'm in denial. I can't believe that he has that. I'm afraid for this IVIG because I know it's a transfusion of blood plasma. I'm afraid there's some risks associated with that as well. And my son, when they were rushing him to the echocardiogram, he was old enough to speak, and he said to my husband and I, why are you letting them take me?
Oh, it's so difficult on everyone, right? On you, on them. I know, very scary for sure.
Very, very scary. So from there, what happened was they began the treatment within 2 hours. I think it takes the 2 hours to make the IVIG. They made the IVIG, they started the administration, and by day six, he received the required dose of IVIG. And by day 7 and day 8, it was like a miracle had happened because his temperatures were down, they're back to normal. They confirmed to us that the treatment was successful. His eyes had cleared up, his rash was gone. He was eating, so he ate his first kind of meal at the hospital with the nurse. The nurse was there and he ate. He had, he went to the bathroom. Like we saw progress by day 8. And then they did another follow-up echocardiogram to see if there was any, damage. And it was like, huge blessing because we were told that we were clear, that we were able to, catch it, treat him. That there wasn't anything that they could see, but to be, for preventative measures, though, Ian still did the aspirin therapy, and that lasted 8 weeks. So after discharge on the 8th day, he had the 8 weeks of aspirin, similar to Shanna, and we also gave him Prevacid because of the Prevacid. What are the words? It protects the lining of the stomach because of all of the medicine, right?
Yeah.
So his doctor, suggested that as well. We did that for 8 weeks at home. And the cardiologist, continues to this day on an annual basis perform an echocardiogram and EKG, and the results are showing normal. So
normal. That's excellent.
We feel blessed, to be honest, but it's unknown still, right? So much has happened since he was 3 and now he's 8, and he has had a couple of fevers, and I automatically was scared because of any fever after that Kawasaki fever. Any fever after that is no longer the same for us and our family. He's
Absolutely.
we've got he's got a younger brother, and we're always looking, right? So we're extremely blessed that we finally got that diagnosis and that we finally got that treatment, and it was all within that 10-day window of opportunity. So grateful for that.
Yeah, that's excellent. I guess building on what you just said there, in terms of the anxiety associated post-treatment, how do you find ways to cope with that? Because I know that's not uncommon amongst Kawasaki disease parents. So I'm wondering if you have any advice you might want to share with families that are new to this.
Anxiety for the child or the anxiety for the parent?
For yourself, for your the parents. For today, we'll have another session about the kids, but for today, parents.
I think it's a matter of knowing that we don't have control of everything that we think we might have control over. And I think knowing that you're advocating for your child's health, and that there is really something to be said about that gut feeling inside, and this level of anxiousness. It's when it's an out of control feeling, right? You feel like it's out of control. So only focusing on what you can focus on, and continuing to keep in mind that you know your child best.
Absolutely. I think that's great advice. I mean, that's the same thing our pediatrician always tells us. So I think that's great. So thank you so much for joining us and for sharing that story. I know it's hard to relive it, but I'm really grateful that you could to share that with everybody, and hopefully other parents gain some knowledge from Ian's story. So thanks so much for coming on today.
Thank you so much for having me.
Okay, great. So I'm going to just share a little bit about my own story. So my son, Isaiah, has a story that started very similar to Owen and Ian's story. He was diagnosed in October 2011, just before he turned 3. He had multiple visits to walk-in clinics and our pediatrician before finally getting the KD diagnosis at the ER of Sick Kids Hospital. Unfortunately for Isaiah, his course of treatment was not a straight path. He required 2 courses of IVIG because he was what they refer to as IVIG resistant. So after his first dose, his fever came back, so they gave him a second dose. And unfortunately, after that, his fever came back. So he ended up doing 2 doses of IV pulse steroids. There was even one point where the rheumatologist started to wonder if he had something else, if it was juvenile arthritis. But luckily, after the second IV steroids, they started oral steroids, and his fever finally stayed away. So even though he received treatment, his first treatment was in the 10-day window, his fever ended up taking a lot longer to actually resolve. When his fingers finally peeled in the hospital, they were satisfied that yes, this was with KD, and he was now entering the subacute phase. When we went back for our 8-week checkup, they discovered that Isaiah had developed multiple giant aneurysms. So ever since that day, our life has just been full of unknowns. Isaiah is closely monitored. He goes to Sick Kids every 3 months, and he gets echoes, and he has a clinic visit, and he gets yearly testing. So either MRI or a cardiac cath. But for me, the scary part is you really don't know what's going on between each visit. So we are grateful that he's seen so often, but in between, you can't see from the outside what's going on the inside. Isaiah had his first cath a month after we learned about his aneurysms. This is when we had a real look at the extent of the damage that he had. And I remember at each echo at the beginning, just hoping, praying for a regression in size of the aneurysm, which is something I should touch on when I talk about the unknown. The unknown can also be good and bad. There are some children for whom their aneurysms actually do regress, and they can be taken off some of their meds. So at that point, the unknown can be a good thing because you can get good news as well. For us, after a while, we just kept hoping for no change because no news is good news. But unfortunately, unknowns have continued to plague us. In April 2012, there was one of our routine visits, Isaiah showed a change in his ECG. They ended up having to do an emergency cath a few days later, and they determined that he developed a clot in one of his aneurysms. So the blood flow to his heart had unfortunately resulted in some permanent damage to some of the tissue. Luckily, he had grown some collateral arteries that were able to compensate for the clot. So he didn't need any intervention or any changes at that point. But again, it was just a demonstration of something that we could not know what going on had been going on between visits. There were no outward signs for him. And then in January 2013, Isaiah had a second diagnosis of Kawasaki disease. It was a little bit different the first time. It was not as, I always refer to as a mild second case. The ironic thing is that knowing as much as I knew at that point, I still didn't think it was KD at first. I was afraid I was being paranoid. So this is when those unknowns kind of haunt you because you're not sure. So you think, oh, I just imagine it. But in any case, his cardiology team said, let's bring him in. And when we went in, all his symptoms just started to pop up, and it was right away. Dr. Young took a look at him at Sick Kids and was like, oh, it's KD a second time. So luckily he had no additional damage that second time. And then in March 2013, Isaiah had complained of some pain in his chest. So we went for a cardiac cath, and they discovered there were narrowings in some of his aneurysms. 5 days later, Isaiah underwent double bypass surgery. So for parents whose children have coronary artery aneurysms, the path is always unknown. We've learned to expect the unexpected. Even though our children are monitored closely, we can never predict what's actually going to happen next. As parents, we deal with every challenge to the best of our ability using whatever resources we have at hand, our medical team, information from other parents. As KD parents, I think having a support system really helps. No one really understands what you're going through or have gone through as a KD parent, except for another KD parent. it is a bit of a special situation. That's why I'm so glad to be part of Kawasaki Canada and head up the support committee. To be able to give that support to other parents means a lot to me, because I know how scary it was. And at the very beginning, that was one of the few things that kept me going, was the support of another parent who knew, because she had been where I was and was able to kind of let me find my way, but still give me some guidance and reassurance along the way. The one other thing I want to touch on was that with COVID-19, which I mentioned earlier, that has had a lot of Katie parents feeling very anxious, and Katie survivors as well, I should say. I mean, there was mention of inflammation, of genetic predisposition, the effects of the heart. These are all terms that you hear in conjunction with Katie. It's a reminder of Katie for every parent out there. They were like, these are all words I heard or I know in relation to Kawasaki disease. And then when the news of Miss C came about and they started actually mentioning Kawasaki disease in the same sentence, many Katie parents were overwhelmed with fear. This fear of the unknown was amplified. So I think, unfortunately, a Katie parent never really puts it behind them, but we learn to navigate our way and arm ourselves with the right information in order to deal with these uncertainties, right? So I think that kind of brings us back to this whole idea of the unknown. It's difficult for parents, and even though you try to put it behind you, you still there will be things that come up later on that will always kind of come back to that. But we do the best we can, and hopefully we can support each other in doing so. So I think that's all I want to share right now about Isaiah's journey. So I'm going to hand it back over to Elizabeth to see if we have any questions.
Great. Thanks so much, Karen, Shanna, and Antara for bravely sharing your stories. And I'm wondering if Antara and Shanna do just want to join us back on screen for a moment. We do have one question that came in anonymously to me that I would love to ask all of you. So have you noticed any difference or improvement in the awareness of Kawasaki disease? So for some of you, this was back 2011, I'm trying to think of the year for Antara, about 5 years ago, I guess, and just a couple of years ago for Shanna. So have you noticed any difference in the awareness? So when you tell people your story or mention Kawasaki disease, has there been an improvement in your mind, or is it still as unknown as it was when you first got your diagnosis? I'll just open that up to anyone.
Yeah, I can start. Can you hear me okay?
Yeah.
Yeah.
For me personally, I've been very vocal about what we've been through. Soon after it happened, I wanted to, join as many places that I could, and Kawasaki Disease Canada being one of them. And as a result, I've seen that friends of friends have reached out, whether it be Facebook or Instagram or whatever social media platform. I have, talked a bit about it at work as well. And I've had people at work reach out to me because so-and-so thinks that this might have happened. And what are your thoughts? So in my mind, yes, I do believe there's been greater awareness of Kawasaki disease. And I think we've made some progress.
Awesome. Thanks, Antara. Shanna or Karen, similar or different perspective?
I would say for myself, I mean, now that I know about it, obviously I'm hearing about it more. I've made it similar to Antara, something that I want to talk about and share more with people. But I have noticed that I am hearing about it, not just in the media, but I keep a lot of my stuff personal and private on any of my social media, but with Kawasaki, I have had those posts be public. And I've actually had people reach out to me. There was a lady who was in Europe and another lady in the States who I guess was just searching Kawasaki, saw my post about my son, and she started messaging me, and we chatted the entire time while she was going through her diagnosis. Her son was in the hospital, the IVIG, and I really hope that it helped her. And there's another lady in Canada actually out west, and we chatted as well. And we're now Facebook friends, and I'll see like pictures of, their children, and their children are now healthy and happy. And so that helps me that I was able to share a little bit, or at least someone was able to reach out and maybe get like some anxiety lessened off their chest when they're having someone who has been through it just listen. And then yeah, and at my doctor's office too, one of the nurses there, she said she heard about Kawasaki when she was doing her training years and years ago. And she asked me if they, at their next nurses meeting, if she could tell Owen's story, because she's like, I can't believe it. You were here and then you were at Emerge and then you went home and then you were at Emerge again. And, you know, you were admitted to the hospital and this went on for days and days. And so she said, can I tell this story? And I was like, please tell everybody. And then I've also talked to my child's school about giving like posters out. Kawasaki Canada has made posters that we can share. And I was hoping that they could just put that out in the hallways or even just share in like a newsletter and things like that. So I think the more that we can do, the more people are going to be aware of it. And my story is only 2 years old, but I feel like there is more awareness now.
Well, that's great, Shanna, and I'm certain that you have helped those that you other parents that you talked to. So thanks for doing that. I really appreciate that. You know, I think maybe before Karen jumps in, certainly that was how Kawasaki Disease Canada was born, because we had told thousands and thousands, it seemed like, of people since our son's story in 2008, and it just seemed like it was never enough. And so we needed to do it in a much bigger way. And I see on the line today, joining in on the webinar, are some other Kawasaki disease advocates and Kawasaki Disease Canada volunteers. And so thank you for joining. And please know that, you know, everything you do to help share our posts, share stories, talk to other parents, talk to other families is really, really important. I see there's another question come in here, and it's so this is a question, I think, for Antara. I heard Antara's son gets yearly follow-up and Karen's does as well. Just wondering how to better advocate for follow-up. I tried getting my daughter a 5-year follow-up last year, but was told no. Karen, any comments on that? Or?
Yeah, so I think, unfortunately, this is definitely a difficulty I think a lot of parents are encountering, because if the actual regulations or guidelines, that the doctors can follow are the American Heart Association guidelines. So the latest one they published is 2017. And within that, there's certain guidelines you can look up based on your child's level of involvement. So if they had dilatation, or if they had an aneurysm that's resolved, if they had no involvement at all, this is the recommended follow-up. So depending on the cardiologist, I think some will be looser with that. So perhaps with Antara's, they are just super careful and are willing to continue to follow iron. But then there's others that will look at that and say, well, based on this chart, you actually don't need follow-up with a cardiologist. So I think, unfortunately, that's a challenge for a lot of parents. And I'm not quite sure exactly where that sits. Like, I know if you ask someone, they'll say, well, just look at the guidelines. But again, it may be a matter of finding different cardiologists willing to do that for you. And maybe they will look and it will be fine. But I can understand as a parent, I understand what that parent's getting at, that whole unknown again, right? Because you don't know, they don't know. There are studies that have been done that show generally most children that have no involvement go on to be fine. Maybe 30 years from now, will it still be fine? This is what the research suggests right now, that they will be, and there's nothing else you need to worry about. But I can understand as a parent, it's your child, so you want to be as careful as possible. So right now, those are the guidelines a lot of doctors will follow. The only thing I could say would possibly be to see if you get referred to a different cardiologist that might be more forgiving with the guidelines and be willing to see you. Again, I don't know this child's history. So depending on where they fall in the chart, maybe they actually are qualified to get follow-up, but this cardiologist is not following that. So I can definitely send them those guidelines if they don't have them, and they can bring that to their doctor and say, well, according to this, you should be seeing my child.
Yeah,
so
that's
that
great.
Parent wants to reach out, for sure.
Yeah, well, we're going to push out a follow-up email with a link to the webinar, so maybe we'll share the guidelines in that email as well. So that's great. And Tara, any other perspectives you would add to that question?
Yeah, I think from our perspective, it's 2016 was when Ian had his diagnosis and treatment. So until 2021, we're offered the yearly follow-ups. But Karen made a point about, family history. Perhaps there's other reasons why we believe that they need to be followed up much longer. And so in our personal circumstances, there were some other things at play, with his siblings, for example, that necessitated us to carry on that heart healthy, outlook in the future for Ian specifically. So we've been very blessed to have the right cardiologists, and we've been very blessed to have them cooperate with our need for healthcare.
Great. Thanks a lot, Tara. All right. Well, we're just about coming to 2 o'clock. So again, I would just say thank you so much to Shanna and Tara, Karen for sharing Owen and Ian and Isaiah's journey to diagnosis and beyond. We hope those that are watching have enjoyed this session, perhaps have learned something new or been provided some sort of comfort. We do have a series. This is the first in a series, as I mentioned. And so here's the dates. I'll just pop it up on the screen for you. These are the dates of our next upcoming sessions. So session 2 will be on Monday, January 11th, again at 1 p.m. Eastern Standard Time. And that is on education. And we have a couple of experts joining us. Session 3 is on Tuesday, January 26th, and probably most of you that are watching today realize that Tuesday, January 26th is Kawasaki Disease Awareness Day. And so we have session 3, our awareness session on that day, and we'll be joined from some Kawasaki disease advocates from Rome and from the UK, and as well as possibly from Barcelona. So that should be a really interesting session. Excuse me. And last is session 4 on research on Sunday, February 14th, which I'm sure you realize is Valentine's Day, the day of the heart. And I've got a tickle. Sorry, excuse me. So with that, thank you very much for joining. Again, thanks for all of you for being bravely to share your stories, and we'll see you next time. Thanks a lot. Bye-bye.